there everyone. Just wanted to try this out while driving because first of all, this shirt really looks pretty amazing with the colors there. But secondly, I just wanted to put some thought about something that I was thinking about the other day with regards to training, and something that I've been also talking to my medical officers this morning, and this is all for my students. Just wanted to put it out there that in this training program there are multiple phases, particularly in the one that we're doing in Malaysia, which is the Masters in Medical Psychiatry or Masters in Psychological Medicine, or in one of the universities they call it, I think, the Doctorate in Psychiatry or something like this. But basically they're the same thing, and these are exit exams for becoming a psychiatrist in the country. And in this 4-year program, if you're not aware, it's a 4-year program where there's a first year and there's a first year exams, and then there's a second year and third year, and then the second part exams happens, and then in your fourth year you're expected to do a thesis, and also at the same time as you're expected to do the thesis, you also have a final year or third part exam, which includes the thesis defense and also what we call a viva consultation. Now I just wanted to share with my trainees, because I know I've not been able to meet some of them due to my schedule and the commitments that I've got within the university and elsewhere, that you've really got to be really good in your psychopathology in the first year, because that's the year that people like us want to see whether you, the student, is a valid instrument, whether the interview skills that you have and the knowledge that you have, the basic knowledge on psychopathology, which is actually identifying symptoms, is what it is. And I would suggest to all of you in the first part that you take the time to read these books that are related to psychopathology, whether it's The Sims or it's Fish, or whatever book you decide to read, that you read it well and you read it thoroughly, because you really want to know all the definitions and all the symptoms that you will be seeing, particularly in the cases that you are taking care of in the wards. Now I'll give you an example. If you have not read about the various types of delusions, for example, and this is if you understand what your delusion is, therefore when you're interviewing a patient you're unable to elicit those symptoms because you did not know that they existed. And this is where people that read a lot appear to be very knowledgeable, and that's true, they are very knowledgeable, but at the same time they've opened their scope and their the mind's eye about the case, because they know so much about it. And I want to encourage my trainees who are in first year to invest some time in doing that. Now this goes again to these people that are doing training, particularly in psychiatry, because that's what I train people in, is that you really need to show that you want it. And as my mentor, Prof. Hussein, used to say, no one put a gun on your head to decide to choose psychiatry. So people and patients and the public and everybody are looking up to you who are in training to become the best psychiatrist that you can become when you come out. Well, that's what Prof. Hussein used to tell us. And we have an obligation to actually do as much reading as we can, to be as competent as we can as psychiatrists. And I just wanted to remind myself and also my students that this obligation requires us to always upgrade and update our knowledge, and doing training in psychiatry particularly is not just a 4-year program, it's a lifelong study, hence why people like us are in academia. But even if you're in public or private practice, as you can see in some of my colleagues that are tagged in this video, for example, or people that I've introduced in my Facebook page, they're consistently giving talks and learning and teaching other people about the various aspects of psychiatry, which is how it's supposed to be. Yeah? So that's for first part. Now for the part 2 exam goers, I'm just going to give a little bit of advice. Again, I give it to my team, and again, like I said, I don't take care of everybody in this university of mine or other universities that might be listening in. That essentially you need to see as many patients, because for the part 2 it's all about the management. We want to know whether you're able to manage a case, and the only way to be able to manage a case is to have a case to begin with, and therefore you guys should be literally hunting and looking for cases to manage, because that's essentially what the part 2 exams is all about. And that requires you to also read a lot about the current management guidelines that are available. I'll give a shout out, for example, if you're doing got a patient who's smoking, we have currently the 2016 clinical practice guidelines that I would expect all of you to know by now, and also to read paper and updates about the field, because the science is consistently changing, the treatments are consistently changing to some extent. There are better ways to manage, for example, people with schizophrenia who smoke, for example, or to manage depression, and you really need to know what's out there. In 2018 it's expected for you to know things like cognitive-based therapy, psychotherapy, psychodynamic psychotherapy, mindfulness, as an example, to be aware of something called relapse prevention. And these are all the psychological treatments that are available out there that you need to know. And you can't go into the exams, for example, not knowing any of these things. And I think that's important. And the only way to know that is, one, to read a lot, which means that again from the first year your reading hasn't stopped, and the second part is to actually do a lot. I mean, to have lots of patients, be really actively involved in the treatment of the patients or patients around you, or people, friends with patients, to really understand fully how to manage the cases that come to you, so that you're able to provide the best treatment available for your patients. So again, I'd like to advise these candidates to see as many patients as you can. And in my team, when I used to have first year, I would say at least 2 patients for the second years and third parts, and 1 patient for the first part, because we want you to have more exposure to managing cases. Now for my colleagues in third part exam particularly, you guys, we have now agreed that you can interview patients. We have now agreed, because you've passed the exam, that you can actually manage patients. So now you're wanting to be one of us, a psychiatrist or consultant psychiatrist. And therefore you need to be involved in psychiatry. And as a specialist, and this is how I view a specialist to be, you've got to be a specialist in the field, a learned person with a high level of knowledge and high level of skill, but also be involved in community service to uphold the profession in the various aspects of it. You can't be a psychiatrist and not know how to run an advocacy program. You can't be a psychiatrist and not be able to know how to manage your colleagues, junior colleagues particularly, when you become a boss one day. You can't be a psychiatrist and not know how to advocate or try to inform the public about stigma, for example. So this is the things that we would expect you to know. We also want you to be ethical, and therefore it's very important for you to be mindful about the boundaries and your limitations and strengths within the profession and within your field of psychiatry. Confidentiality, for example, is highly important, that you really need to know. And also how you deal with other people, because again, after you've completed this year's program in part 3, you then become the psychiatrist. And as an educator in psychiatry, I want the people that come out from at least my team and my university to be the best that we could possibly produce, and to make the profession proud of you, and also to make your patients happy, because we were contributing to your development. So I just wanted to give that little advice and to try out this way of vlogging. I don't know whether it's clear or not, but hopefully, you know, if I had a thought, then I'll be able to share it with you guys. And again, just wanted to give a shout out to the seller, Matase boutique, for this really cool batik shirt that I'm wearing at the moment. So adios guys, keep on studying, and hopefully we'll see you on the other side. Bye bye.